This video will explain the information about deprescribing alpha-1 blockers. So you're probably wondering, what is deprescribing? Deprescribing means lowering the dose or stopping a medication that may no longer be helping or may be causing harm. So why do we deprescribe in hemodialysis patients? Hemodialysis patients may take up to 12 medications each day. Also, since many medications are not studied in hemodialysis patients, the benefits and harms are unknown. Hemodialysis patients may also have a hard time getting rid of medications from the body, so patients may experience more side effects. What are alpha-1 blockers? Alpha-1 blockers are medications used to reduce high blood pressure and to treat a prostate problem called benign prostatic hyperplasia, or BPH for short. Some common examples of alpha-1 blockers include alfuzosin, doxazosin, or tamsulosin, also called Flomax. You may ask, why should we reduce or stop the dose of your medication? In patients who produce very little urine and have no symptoms of BPH, there is no longer a need to take alpha-1 blockers. These medications have been associated with serious side effects of heart problems and very low blood pressure leading to dizziness. So we want to reduce or stop your alpha-1 blocker dose. How do we do this? If you produce less than 1 cup of urine each day and have had a confirmed diagnosis of BPH in the past, you may be considered for the alpha-1 blocker deprescribing trial. Your healthcare team will help decide the best way to reduce or stop your medication. This may include slowly reducing the dose you receive for a few weeks before stopping the medication altogether. Your healthcare team will monitor you after reducing the dose or stopping your medication. They will observe and ensure your blood pressure remains appropriate. You may be wondering, what can you do if your high blood pressure continues? Your healthcare team may recommend starting a different medication, for example, Ramipril. But there are also other ways you can manage your blood pressure. This includes limiting your fluid intake, as well as decreasing the amount of sodium you consume. For example, limiting the amount of canned soup and pizza in your diet. You can speak to your dietitian to learn which foods are right for you. Overall, the goal of deprescribing is to lead to better patient care. Please contact your healthcare team before stopping or changing any medications.